What is atrial fibrillation? In atrial fibrillation there is disruption of the normal sequence of atrial contraction followed by ventricular contraction. In atrial fibrillation the atria beat irregularly in a manner that is out of coordination with the ventricles. What are the risk factors for atrial fibrillation? The risk factors for atrial fibrillation include hypertension, myocardial infarctions, coronary artery disease, valvular heart disease, and hyperthyroidism. Other risk factors include stimulants, medications, caffeine, tobacco or alcohol, sick sinus syndrome, lung disease, viral infection, illness, pneumonia or surgery, and sleep apnea. What are 4 conditions that commonly cause atrial fibrillation in the post-operative setting? In the post-operative setting, atrial fibrillation is associated with fluid overload, pulmonary embolus, myocardial infarction, and pain. What is holiday heart? Holiday heart is atrial fibrillation related to alcohol binges. These usually resolve within 48 to 72 hours after discontinuing alcohol consumption. What is the annual risk of stroke in a patient with atrial fibrillation who is less than 60 without hypertension, history of embolism, diabetes, or depressed ejection fraction? The risk of stroke in this setting is about 0.5% to 1% per year. What are the factors associated with increased incidence of thrombosis in patients with atrial fibrillation? Thrombosis associated with atrial fibrillation has been associated with hypertension, diabetes, congestive heart failure, valvular heart disease, history of TIA, and age over 75. How successful is cardioversion for atrial fibrillation? Cardioversion restores sinus rhythm in 70 to 95% of patients. Sinus rhythm is present after 12 months in 1/3 to 1/2 the patients with chronic atrial fibrillation. After extensive metabolism by the liver, it is primarily excreted in the bile. Does renal failure alter the metabolism of atorvastatin? FlashMed, video flashcards.